Can GERD cause your chronic cough and throat clearing? Imagine a tiny fire inside your chest that keeps flickering and causing trouble in places you never expected. That's what happens with gastroesophageal reflux disease, or GERD. It's more than just heartburn. When someone has GERD, stomach acid sometimes flows back into the esophagus, the tube that connects your mouth to your stomach. This reflux can irritate the lining of the esophagus and even reach higher into the throat and voice box. This condition is called laryngopharyngeal reflux, or LPR, often called silent reflux because it might not cause the usual heartburn. LPR irritates the delicate tissues in your throat and vocal cords, which are not built to handle stomach acid. This irritation can lead to a persistent cough and the frequent need to clear your throat. You might also notice hoarseness, a feeling of a lump in your throat, sore throat, or trouble swallowing. The cough caused by GERD is a reflex. It happens because acid irritates your airway and throat. Even small amounts of acid can trigger this reaction. Interestingly, coughing can make reflux worse by increasing pressure on your stomach and esophagus, creating a cycle of irritation and coughing. Besides cough and throat clearing, GERD symptoms can include regurgitating acid or food, a sour taste in your mouth, and difficulty swallowing. Doctors often diagnose GERD by looking at your symptoms and may suggest tests like pH monitoring, which checks for acid in your esophagus and throat. Managing these symptoms usually involves lifestyle changes. Avoid trigger foods like spicy or fatty dishes, eat smaller meals, and don't lie down right after eating. Losing weight can also help reduce pressure on your stomach. Medications that lower stomach acid or prevent reflux are often prescribed. In many cases, treating GERD can lessen or even stop the chronic cough and throat clearing. It's important to address the reflux because ongoing irritation can lead to more serious issues over time. If you notice these symptoms regularly, talking to a healthcare provider can help you find relief and improve your quality of life.